Can children and toddlers get COVID-19? Yes, children and toddlers can get COVID-19. Cases have been increasing among children. The widespread circulation of the highly contagious omicron variant of the coronavirus is a key factor. Parents and caregivers should understand that children infected with coronavirus can develop complications requiring hospitalization and can transmit the virus to many others. In rare cases, children infected with the coronavirus can develop a serious lung infection and become very sick with COVID-19. And deaths have definitely occurred. That's why it is important to use precautions and prevent infection in children as well as adults. Hi, I am Firdaus Mudassir and welcome to my channel Women and Childcare. Today we are talking about prevention and symptoms of COVID in babies and kids. What should parents know about coronavirus variants and children? Coronavirus variants, including the very contagious Omicron variant, continue to spread, particularly in areas with low rates of community COVID-19 vaccination. For children too young to be vaccinated and adults who have not received coronavirus vaccines, it is important to follow proven COVID-19 precautions such as mask wearing when in public, indoor places to reduce the chance of becoming infected with the coronavirus. Indoor activities are riskier than outdoor activities, but risk can be reduced by masking, distancing, hand washing, and improved ventilation. As a parent, here are some precautions you can take for your child during the COVID-19 pandemic. Here are few precautions parents and children can take to avoid this infection. Number 1. This is the best time to inculcate positive hygiene practices in your children. This includes washing hands thoroughly, using hand sanitizer, the importance of personal hygiene, avoiding any sort of social gathering, especially if they want to play with other children. Number 2. You must teach your children the right way and the right time to wash their hands. You can refer to the guidelines set by WHO. The guide will take you through the right way to wash and disinfect your hands, especially between your fingers and underneath your fingernails. You also should teach the child to wash their hands with good soap before touching their face or eating. Tip number 3. Wash hands frequently using soap and water for at least 20 seconds or frequently use alcohol-based hand rub. Wash hands especially after coughing, sneezing or touching objects like door handle which are likely to be touched by others as well. Number 4. Educate your child to cover the mouth and nose with a tissue or flexed elbow while coughing and sneezing. Dispose the used tissue immediately and wash hands with soap and water or use alcohol-based hand rub. Do not touch any objects or face after coughing or sneezing. Number 5. Establish a routine that is age appropriate and can be followed easily. You can include play and reading time and use them as learning opportunities for your kids. Don't forget to come up with plans with your kids wherever possible. Don't forget to be flexible with your child's activities, switch them up and flip to a more active option if you feel that your child is getting agitated or restless. Number 6. Clean the child's toys at least once a day. Number 7. Clean the floor and commonly touched objects at least once a day at home. Number 8. Don't allow your child to come in close contact with anyone who has cold, fever or flu-like symptoms. Number 9. Try to engage your child in indoor activities. Avoid outdoor activities as much as possible, but one can allow activities in the house premises provided the number of children is not more than 4 to 5. Children with fever, cough and running nose should not be allowed to meet others, especially the elderly or the grandparents. Number 10. Don't take children to crowded places. Keep them indoors as much as possible. Number 11. Don't forget to give a nutritious diet with plenty of water. Give citrus fruits like orange, lemon, grapefruit, and vegetables which are rich in vitamin C, vitamin D containing foods such as cheese, egg yolks, and zinc containing foods like legumes, lentils, beans, and nuts. Tip number 12. Mothers can continue breastfeeding if they develop COVID-19 disease, but the mother should take due precaution to prevent transmission like use mask, washing hands before and after contact with the child. Number 13. Seek medical care early if your child has a fever, cough, or breathing difficulty. Tip number 14. Have open conversations with your kid and encourage them to ask questions along with expressing their feelings. You must remember that your child will have a different reaction to stress, so be patient and understanding. You can begin by inviting your child to talk about the issue that's bothering them. Find about their knowledge of personal hygiene and the importance of washing their hands. Tip number 15. Cyberspace and digital platforms are chock full of information, but as a parent, you need to filter out the data to what is appropriate for your kid. You have to discuss the internet with your children and make them understand why there are certain restrictions in place. Ensure that the information accessible to them is for their safety and knowledge. Number 16. Stay in touch with the child's education facility. This means staying in touch with your child's teachers or school. As a parent, you need to stay informed, receive guidance, and ask questions wherever necessary. Community and parent groups are a great way to support each other, especially while homeschooling during this COVID crisis. So, what are the COVID symptoms in babies and children? Generally, COVID-19 symptoms in kids and babies are milder than those in adults, and some infected children may not have any signs of being sick at all. COVID-19 symptoms for children and adults include cough, fever or chills, shortness of breath or difficulty in breathing, muscle body aches, sore throat, new loss of taste or smell, diarrhea, headache, new fatigue, nausea or vomiting, congestion or runny nose. Fever and cough are common COVID-19 symptoms in both the adults and the children. Shortness of breath is more likely to be seen in adults. Children can have pneumonia with or without obvious symptoms. They can also experience sore throat, excessive fatigue, or diarrhea. However, serious illnesses in children with COVID-19 is possible, and parents should stay alert if their child is diagnosed with or shows sign of the disease. So folks, that's it from me in this video. If you have liked this video and the other videos on this channel, make sure you hit the subscribe button and also click the notification bell icon. You can also follow me on other social media platforms like Instagram, Facebook, and LinkedIn. In case of any doubt, query, or inquiry, make sure you write to us on the email ID given in the description box. See you in the next video. Thank you so much.